Okay. Also in North Yorkshire.
Yes.
In one slide. And John, I think we need a conversation. And I can't remember whether you've been in touch with. I've got two hats. So I run Whole Systems Partnership. You've had a little bit of this in a previous meeting, although maybe not many of you were on it, from Sarah Overton from our work in Kent. But I live in Knaresborough, North Yorkshire, and I also have a hat of establishing, running, providing strategic input to the community support organisation for COVID for Knaresborough. And with, I'm actually using, John, you'll be pleased to know, the North Yorkshire BI output that's publicly available to inform our local community support organisation. So, and I could argue that there could be even a closer symmetry between the two, which we might have a conversation about. So two hats, but the strategic Whole Systems Partnership hat. I'm just going to talk through this single slide and also give credit not only to the support that Kent and Medway have given us across health and social care, but also the wider team behind me. We're a relatively small team, but 4 or 5 of us. The list there on the right-hand side of open data that's used to triangulate and sense check our system dynamics model was provided to me by Chris Harwood, who's our public health analyst and modeler. So Whole Systems Partnership, strategic consultancy, expertise in population health modelling as it informs NHS and social care strategic demand and capacity work. So we help the NHS answer questions about how much of what. And when these answers are complex, then the system dynamics approach, which many of you may be familiar with, is really helpful. And it obviously gives us some forecasting potential. Although the small chat at the start, the sort of warning signs about forecasts and exponential increases, and I've been just as PIISS soft with some of what's been going on as many of you. So COVID-19 clearly presents one of the biggest challenges to face since the NHS is its inception in terms of demand and capacity. Questions about capacity right the way across the system are being asked. But along with the rise in COVID cases, I've recognised and seen, I think it's been a marvellous opportunity for open sharing data that has previously been closed to people, as well as accelerating the use of open source data. So the slide being shared in front of you tells the story in brief. An SEIR model follows the progression of a virus through the population through susceptible, exposed, infected, and finally recovered. And that's what's underpinning the model. We, with permission, used in effect an open source model within the system dynamics community built by IC Systems in the States. System dynamics is regularly used for epidemiology and sort of progression of disease boom and bust type modeling. So we picked that up early in March, and at many iterations later, as we're finding out both about the disease and the virus and the progression and the way in which we behave in response to it, we've got an emerging model. The model outputs that you see here, which I'll explain in a moment, are only a week old, but we're at a significant sort of transition point, if you like, in terms of understanding the roadmap, not only in terms of the current lockdown, but also in terms of vaccination and mass testing. Many unknowns, and therefore caution and care. So the model that we've built, we've also been fortunate during the time that we've been building the model to access a group of volunteer actuaries who've helped us along the way. We've got a model that can be calibrated to any district, local authority, CCG up and down the country. We've done that for the North East and North Yorkshire and Yorkshire for purposes of informing strategic workforce planning and medical training places and the like. So, and also around other sort of strategic planning where there is a COVID overlay in terms of how we plan forwards. So the model itself generates new cases of COVID-19 from rates of exposure to others in different settings: home, work, education, retail, recreation. The more the contacts, the greater the transmission, ultimately, therefore, the more hospital admissions and deaths. and we apply the existing and anticipated restrictions in those contact rates and the evidence around to help us to do that. From the slide that you can see how mobility data for retail and recreation, so there's a little sort of inset there, mobility data, retail, that's an open source data set. It tracks what we were modeling, or rather it underpins the outputs of what we're modeling. So you can see there on the first peak how mobility data sort of fell through the floor, 20% of normal, rose gradually. There's a lovely little spike there in terms of just the last 3 days before the 4th of November when everybody went out to shop again, and down it goes to about 40% level. So that sort of data is being used regularly to import the model and then to help us to triangulate with the outputs that we see and the real data in terms of hospital admissions, deaths, and the likes. The triangulation with TTI data is a little bit more difficult because clearly it's not identifying everybody in the population who is either asymptomatic or symptomatic for a range of reasons. So to improve model forecasts, we therefore rely on both a constant iteration and comparison with other sources. ONS infection survey provides us another triangulation point open to us. But in terms of where we're going, in terms of forecasting, my first master's degree was in meteorology. So the little chat about the rain yesterday, you needed to take advice from a decent weather forecaster. But if I distinguish between nowcasting and forecasting, it's a useful distinction we've made in the Kent work. In terms of the weather, if you look out of the window now, it's probably quite sunny. You can look up wind, you know whether to put a coat on or not in terms of whether it's going to rain in the next few days. But if you want to know whether to book your camping holiday next year, or whether it's going to be a beast from the east or a wet and soggy winter, you turn to forecasting rather than nowcasting, which is full of a whole range of other vagaries in terms of what's actually going to be happening. So the output that you see here, it's a two-year model. It's got the first peak, it's got the second wave. You'll see where we are just at the start of that climb up midway through November, and the point at which the model outputs there depart for hospital admissions across Kent and Medway. This is, you can see the inflection points with the impact forecast of the 5th of November lockdown. You've then got 4 outputs. You've got the red dotted line, which is the impact of that 4-week kick it down the road strategy to get us to a Christmas that we might be able to enjoy. More comment offline on that, I suspect. And all it does is kick it down the line. The pink dotted line is the potential impact of mass testing were it to be effective, and we've made some assumptions which we can share. And the fourth line is the start of a vaccination program. And depending on the rollout, then that will have different effects. And we are practically answering questions. We've got a meeting later this afternoon with the excess deaths management group in Kent. Do they or do they not need to open up extra mortuary capacity at some point? We were able to advise them they didn't need their big tents in the first wave. We forecast that. They stood them down, they didn't need them. Don't repeat it here because they haven't heard it yet, but I think they might need a bit in January and February. So the value of forecasting, not to give a certainty, but to give a sort of plan for the worst, hope for the best type approach, based on a whole range of iteration, local data, open data, all triangulating to provide something that's reasonable for local strategic planners. So that's what you see, that's what we've done. I've described a little bit about where it's available and where it's being applied, but happy to take other questions or have the conversation.